Good morning, friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe my channel and also please give your valuable comments. You can also visit the playlist. In the playlist, I have provided all the topics so far we have discussed in a very systematic order so that it is very easy and convenient for you for the study purpose. Anyway, as we know, in the last class, we are discussing about autism and we have been discussing about the basics of autism. In that regard, we have already completed 6 or 7 parts, and in the last class we have seen investigations related to autism. And today we will discuss the differential diagnosis. Now, differential diagnosis of autism is very, very important because when you are sitting in the OPD or in the clinical setup, when the patient comes to you, at once you cannot diagnose a case as autism because there are so many other mimicking disorders are there which create confusion with the autism, and many times you may misdiagnose. So there may be misdiagnosed many times. So to avoid all such errors, at least we should know 3 or 4 important differential diagnoses of autism. So first differential diagnosis is a global developmental delay. Now global developmental delay is a condition where more than 2 developmental domains are get affected. We know social development, language development, fine motor development, and cognition developmental domains. Now if these domains, if the more than 2 is get affected, then usually we'll call it as a global developmental delay. Now in this global developmental delay, again 2, that is social and language may come. So if a case of global developmental delay along with the social and language developmental delay associated, then it may create a confusion with the autism. We know that in case of autism, there is basically language and social developmental delay will be affected, or domains will be affected. So therefore, global developmental delay is one of the important differential diagnoses. Now how to differentiate? Global developmental delay may be the outcome of birth asphyxia, perinatal events, or meconium aspiration syndromes, or ventricular hemorrhages, etc., or some of the metabolic disorders, some of the congenital disorders related to CNS, and so many other post-febrile sequelae like post-meningeal sequelae, etc., may lead to global developmental delay. But in a pure case of autism, always the motor and as well as fine motor, that will be perfectly all right. Only social and language may be get affected or will be affected in case of autism. So that is how we have to differentiate. At times, there may be a case of global developmental delay where social development and language development is get affected along with other developmental milestones are also getting affected. That is possible. That is possible. But all such cases are not autism. Whenever there is social and language is get affected, it is not always called as autism. If only social and language developmental domains are get affected, and all the other 3 are normal, then usually we will think about autism. Okay, so this is one important thing. Second important differential diagnosis is attention deficit hyperreactive disorders. Now in the context of autism, in the basics, we have already seen in autism there may be hypo-response or there may be hyper-response. So whenever there is hypo-response, okay, the delayed movement will be there, sluggish movement will be there, it's okay. But some patient of autism may present with a hyper-responsiveness, that means exaggerated movements. So when these exaggerated movements are there, usually it may create a confusion with the hyperreactive disorders. Hyperreactive, that is attention deficit hyperreactive disorders. So this may also create confusion with the autism sometime, because in autism also there will be, in those cases with the hyper-responsiveness, he will have exaggerated body movements. Okay, he is beating himself and the movements are more and running here and there. So these type of movements can be seen in case of autism if it is a hyper-responsive case. Okay, so that definitely create a confusion with the ADHD. So how to differentiate? In case of ADHD, a pure case of ADHD, usually the language and social developmental milestones are not get affected. Okay, now talking about motor developmental milestone, fine motor and these 2, so they are not affected in autism also, they are not get affected in ADHD also. The problem comes with the social and language. In ADHD, actually there is a pure case of ADHD, there is no involvement of social and developmental milestones. But it looks that this patient has got social developmental delay because the patient of ADHD, attention deficit, because of the attention deficit and because of the hyperreactivity and because of the impulsivity, he is not talking to somebody for a particular time. He is not able to give the time. Immediately he jump into the next conclusion or next contest. So that it gives a false impression, or it gives the impression that this patient has got some social problem. Otherwise, in a pure case of ADHD, there is no social involvement. Social developmental milestones are not affected. Because of his hyperactivity and because of his problem with attention, it gives a impression. Similarly, the language is also not much affected in case of ADHD. It gives the impression that the language is affected because he is not able to concentrate. He is so hyperactive that he is not able to listen to your voice. Okay, you listen to your words. Okay, he jumps into another context immediately. So that gives the impression that this patient may also have a language problem. Actually, it is not so. So this is the main differentiation factor. In case of autism, either social or language is get affected, whereas in case of ADHD, there is no social and language domain affected, although it gives a false impression. That is the reason why it is one of the differential diagnoses. Okay. Third important differential diagnosis when we talk, it is social communication disorder. Yes, this is very important. Many social communication disorders also give a false impression of autism. Now, social, as a word suggests, communication is biggest problem. Communication, social communication. That means when that particular child moves in the society, when he is in between 3 or 4 members or in between the friends, he will have a problem in the communication. He is not able to communicate. Okay, so he may be afraid of talking to somebody, or he may feel introverted, or he will have some problem in the communication. He didn't find some of the words that he has to say, or sometimes there may be stage fear or nervousness. So all these factors altogether may give a false impression of a child with autism. Actually, in case of autism, social and languages definitely get affected. But in case of social communication disorders, all the developmental domains are normal. Even the social developmental milestone is also normal. Language is also normal. The problem is only with the communication. He knows everything. He understands everything. Okay, he is receiving all the signals, but still he will have some problem with the communication. So that is how we have to differentiate these social communication disorders. Fourth important differential diagnosis is stereotyped motor disorders. So stereotyped means similar, okay, monotonous or similar. There are so many other motor disorders are there where the baby or child shows a stereotyped motor movements. For example, tics. In the tics, there will be stereotyped movements. Okay, habit disorders, thumb sucking, nail biting, pulling the hair, etc. Then chorea, athetosis. Okay, so these are some of the motor stereotyped disorders, stereotyped motor disorders. A rhythmic movement is there. Now, this also create confusion with the autism at times, because in case of the autism also, the sameness and as well as repetitive behavior is very common. Repetitive body movements, repetitive motor movements. So these are quite common in autism and one of the important factor for the diagnosis also. So as here the child is having stereotyped motor disorders, it may create confusion with the autism also. How to differentiate? In autism, social and language is badly affected, whereas in stereotyped motor disorders, although there is continuous repetitive movements are there, all the developmental milestones are normal. Maybe to some extent fine motor and as well as motor developmental milestones may be get affected. So these are the very important 4 differential diagnoses when we talk about autism. So whenever we are diagnosing the case or we are suspecting about autism, initially we have to rule out these important 4 disorders. So thank you very much for being with me. So please don't forget to subscribe my channel and also please give your valuable comments. In the next class, we will discuss about management aspects of autism. Thank you very much.